So the results were very intriguing. So Dr. Morris et al. From Emory University School of Medicine, as you know, recently reviewed the organ procurement and transplantation database from 2000 to 2012 to evaluate the effect of race and pre-transplant panel reactive antibody on heart transplant outcomes. They found that race, ethnicity, and a level of sensitization are important predictors of graft survival. Thus, the findings of the study should stimulate additional research and clinical investigation to help determine why there still is this disparity and what measures can be taken to improve the outcomes for these patients. In the interim, the findings from the study will influence pre-transplant discussions with the patient and their families. The better informed the patient, the more likely they can participate in the current care process to optimize their long-term outcome. It should also raise awareness for programs to evaluate their own individual outcomes based on race, ethnicity, and sensitization to try and identify best practices and modify them when necessary to improve the outcomes and in these patients in this high-risk subset. So I think that it will influence the discussions, and it will alter the family participation as well going forward. So unfortunately, no. We knew that the disparities were identified in the past, but the fact that they still exist was not a surprise. Heart transplantation is currently performed at about 100 centers in the United States. And despite what appears to be a small number of centers with highly specialized teams, many programs still perform less than 14 heart transplants per year. Blacks and Hispanics are more likely to be listed at these smaller volume centers. It's frequently difficult for smaller volume programs to have the additional resources that might be necessary to treat these unique subsets of heart transplant patients. So, unfortunately, we're not surprised, but by raising awareness, it may help stimulate a more rapid improvement in evaluation that will lead to better outcomes in these subsets of patients.